Previs Diabetes intelligence platform was created for the healthcare professional in a type 1 diabetes outpatient clinic setting. And with this in mind, 5 minutes. 5 minutes before a patient is sitting in front of you expecting a personal consultation. 5 minutes for you to review a mountain of data, including over 288 average glucose readings from a continuous glucose monitor. In addition to the pump activity logs, insulin boluses, meal logs, and physical activity. The problem is, it really just is impossible to review all these data points thoroughly in such a short amount of time. And that can lead to things being missed. The Previs tool doesn't replace any of the current databases, EHR systems, or clinical monitoring. It purely sits on top as a clinical reasoning layer. It doesn't just show raw data, but it provides context to the patterns shown to the numbers. And it operates as a stateless server, so it doesn't store anything, but instead acts as a real-time detective and pulls in all the data, normalizes it into a FHIR-compliant schema, which nowadays is basically the universal language for healthcare data, and synthesizes a pre-consultation brief in seconds. And now I'll show you how that's done. You can connect any LLM of your choice. In this first demo, I'm going to be using Claude. So I'm going to ask, show me my patient dashboard using Previs. When using the Previs tool, the authentication is done through the login of your real database or EHR system. And then once it is finished finding your patients, the default setting is a 2-week review. And I can see all of my patients according to risk, and they have all of the glucose trends and numbers that are important when assessing a patient. And then we have a little bit of a summary down here written by the AI. And we see that Lucas is the most urgent at this time because of low glucose events. So Lucas is about to come into the room. So I'm going to say, prepare a pre-consultation brief for Lucas Morrow. And now that we have the pre-consultation briefing generated, we can quickly look at his profile and everything that's going on with him before he comes into the room, including his nutrition, hypoglycemic risk patterns, and some talking points during the consultation. So Lucas is in the room and I want to talk to him about his hypoglycemic episodes. So I'm going to ask the tool to tell me more about it. So I have all of his hypoglycemic risk patterns, including time below range, severe lows, glucose variability, and his nocturnal episodes. I also have a chart of the 14 days and the nocturnal events, so I can visualize when this is actually happening. This is also available on the Prompt Opinion Marketplace. We believe this is a tool that's going to save healthcare professionals a lot of time when creating these pre-consultation briefings and recognizing patterns in their patients with type 1 diabetes.